Okay, final section on our tissue response to injury. So hopefully you've gotten a good review on our tissue response since you guys have learned it a couple times already. Hopefully you're feeling comfortable and also understanding a little bit more of where the modalities potentially fit in. Our final piece here is, again, on the consequences of the injury that happens, and the consequences of potentially not moving the tissue response cycle through the way we should. And that's on muscle guarding and muscle spasm. So when we have that injured tissue, we know that we are moving through the inflammatory response, eventually getting to the proliferation phase, eventually to the maturation phase. Now, as a consequence of this process, we also know that we get pain, right? Our 5 signs of inflammation. We see redness, we see pain, we feel warmth, we have loss of function, and we have swelling. Again, if the cycle goes kind of as planned, we will have minimal consequences of that process. We'll see additional swelling, but the body should respond and be able to move it out. Okay, we are hopefully not getting a ton of secondary cell death, and especially if we decide to put cold on, if we decide to use elevation, if we decide to use compression, we can help reduce those. But the other consequences of injury we have are to tissue that is not damaged at all, but is affected by the injury, and that's to muscle tissue. Okay, so muscle spasms. Muscle spasms happen in the muscles surrounding the injury. So if the injury happens to a muscle, it's going to happen to the muscles around that area, sometimes usually counter to that muscle. So like if an injury to the quad, the hamstrings might also spasm, the hip muscle spasm, the lower leg muscle spasm, and the whole idea being that we get this involuntary contraction of the muscle fibers to help splint and protect the area. So the other quads will spasm, and all that is there so that we don't screw this up. So we don't continue to do the activity that harmed the tissue to begin with. So it's all about, remember, our price or our police. It's about protection. Your body is trying to protect it. We don't want that muscle spasm to happen though. Okay? Because the muscle spasm, which is caused from that direct trauma, caused from the decreased oxygen available, right? The start of secondary cell death, as well as neurological dysfunction. So as that tissue got disrupted, the nerve fibers got disrupted. And so they're not firing the way they should. They're not sensing the environment the way they should. And again, so the body kind of goes on lockdown and uses muscle spasm to do that. That muscle spasm, while helpful, also is causing issues. So remember back to the very first video, and we had that diagram, and we had the right side was the normal, yay, we're moving towards healing. The left side was where we get stuck in this bad place, in this bad spasm cycle. Spasm is a part of that because it stimulates mechanical and chemical pain receptors, and it stimulates pain. The more pain we have, the more we're going to spasm. The more spasm we have, the more pain we're going to have, and we're going to get stuck over there, and that could also then result in secondary cell death and more injury and more issues. The concern with muscle spasms is eventually we need to get to the point that we can start doing the optimal loading of the police, right? The SAID principle, the specific adaptations of imposed demands. Eventually we got to start moving this body part so that normal function can occur. We might even have to be moving this body part just to get lymphatic drainage, right? We talked about ankle pumping and we talked about passive motion. And if we're in really a lot of muscle spasm, that's not going to happen. And so we really need the muscle spasm to not hinder all this. And so we need to get rid of that spasm kind of as soon as possible. And part of how we do that is to protect the area artificially. If we put them in a brace or put them on crutches, put them non-weight bearing, put them in a sling, the body can go, whew, okay, we're not moving. We feel okay, we can relax. And those muscles around the area can decrease their spasm. And now we can get in there and do the type of motion that we need to do to help them. Another kind of side effect is if we don't control this muscle spasm, Or we do so well, we put them in protection, we put them in an ankle brace, we put them in a cast, we put them on crutches, we put them in a sling, and we don't do all of that really good progressive resisted activity that's part of our rehab, right? We progress them from passive and into more active range of motion, into strengthening. If we don't do that well enough or soon enough, so either if the spasm continues too long, or if we protect the area too well and don't push them into movement, we can result in muscle atrophy and weakness. And if the muscle becomes atrophied and weak, now we really can't start rehab well. Like we have to go back and re-strengthen that muscle to then just the area it was that injury, to be able to then get us post the injury. So edema and inflammation end up stimulating the Golgi tendon organs. So they feel that inflammation, it feels that pressure from the edema, and that tells the body to try to relax and that this tissue shouldn't move. And so then we get this increased rate of atrophy because we're not using it. And when we don't use it, it can lead to reflex inhibition, which means that it can actually shut down our reflexes to like normally function. And also what we call arthrogenic muscle inhibition, which is AMI, which is a presynaptic reflex inhibition. So it's caused by joint effusion. So as that swelling sits in the joint, it interferes with how the motor neurons of these muscles that cross the joint are recruited, and then they atrophy. And then that then hinders the rehabilitation process by delaying strength gains. It interrupts joint proprioception, which we know is huge, right? That's why we do all these balance activities after a lower extremity injury. And even for upper extremity, we do a lot of weight bearing, planks, things like that to try to regain that proprioception. We want the tissue to know where it is in space so that it doesn't injure itself anymore. But if there's a lot of swelling in there, it puts artificial pressure on those receptors, and it can't sense position anymore, and they become disused. And then we're at bigger risk of injury because now we're more likely, even once this tissue is healed, if we don't regain that proprioception, we're likely to put ourselves in positions where it can get injured again. Hopefully that makes sense. This is why we do the rehab that we do. This is why we progress the way that we do. Because if we don't, that tissue and the muscles and the joint, they don't respond in the same manner anymore. And so we need to help that along.